Wireless one.
But we have
So cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Okay, that is what cancer is. You can see here how, see, on a daily basis, lots of cells in your body are undergoing differentiation, proliferation, and differentiation. Okay, which means old cells are getting replaced by new cells. Okay, in every 3 to 4 months, all the cells of your body, they have to undergo this cell differentiation and proliferation in a very controlled rate. Okay, in a very controlled rate, cell differentiation takes place in a very controlled manner. All the cells, one by one, they get replaced by new cells. Okay, but when certain cells, certain bundle of cells or tissues, they proliferate and differentiate at a very accelerated rate, okay, imbalanced rate. Okay, the surrounding areas you can see here in this cancerous region, the surrounding areas may be differentiating at a normal rate, okay, but the affected area is differentiating and proliferating at a very accelerated rate, okay, in a very speedily manner. Okay, these new cells are supposed to come in 6 months. Within 1 month, new cells are being produced, and where they will go, they will form a tumor. Okay, this is how cancer is produced within the body. Okay, it can start almost anywhere in the human body, which is made up of trillions of cells. Okay, normally human cells grow and multiply to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells, which are newly generated, newly differentiated, they take the place of old cell. Okay, this is the natural physiology of human body. Okay, sometimes this orderly process which is under control, okay, this new cells taking place of old cells, okay, this orderly process breaks down, it becomes abnormal. Damaged cells sometimes, okay, they can also grow and multiply, but they are not supposed to. Damaged cells are not supposed to grow and multiply, they are supposed to die off and they should just break down. Okay, they should just undergo apoptosis. Okay, but sometimes it will not happen. So these cells may form tumors, which are lumps of tissues. Tumors can be cancerous, it cannot be cancerous as well. If it is cancerous, we call it malignant. Okay, we call it malignant. I will type the spelling in the chat box. Malignant means cancerous, okay, which means they can spread. Today, if this malignant tumor you caught in your lungs, after 1 month or 2 months, you will see the same malignant cells in your kidneys, in your bones, in your intestine. Malignant cancer spreads. Okay. Benign cancers are tumors. Okay. Benign cancers are tumors. They are just stuck in one area. They can be removed surgically. Okay. So this is the introduction to cancer. Is it clear to all? The basic difference between benign and malignant. How cancer happens. From where does cancer take place? So symptoms of cancer, very important. Fatigue, tiredness, okay? Because what would be the reason? Can anyone say what would be the reason why a person may become tired or fatigued when they are suffering from cancer? Not because of medication. Apart from medication, just think about physiologically what's happening from a nutritional point of view. Anemia only if the tumor is bleeding, if it is a tumor that is bleeding. from a nutritional point of view, body is still absorbing nutrient. Okay, body is still able to absorb nutrient, but imagine lot many cancerous cells are proliferating. These cells also require food. They act like a parasite. They take away all the glucose, carbohydrates, proteins to differentiate and proliferate more and more. So what happens? The healthy cells, they get deprived of nutrition. Understood? Tumor cells, why it is important to remove tumor? Because the tumor cells are also feeding off. Tumor cells, cancer cells are also feeding off the nutrient that are supposed to be fed to the host body. Okay, so that is one of the reason why fatigue comes in. Another form of fatigue comes in when a person goes into chemotherapy, radiation therapy. As a side effect to all this, fatigue can seep in. Okay. Lump or area of thickening that can be felt under the skin. Okay. For example, you must know about the breast self-examination. Okay. Women are supposed to explore, navigate their breast properly. There is a ritual, a step-by-step procedure in which while taking a bath, after bath, okay, during their own private time, they have to check their, inspect their breast to feel any lump or area thickening, specifically under the nipple area, around the nipple area. Okay, under the just the breast area, which is closer to your underarms. Okay, these areas are more commonly prone to cancer. Okay, breast tumor or cancer. So any area that any epithelial cells, specifically epithelial cells, okay, that undergoes cancer or that has begun the cancerous proliferation, lump or thickening of that area can be felt. Okay. Can you feel any lump or area thickening in case of leukemia? Leukemia is blood cancer. There is no lump or thickening in case of leukemia because blood cancer, the fluid connective tissue, that is your blood, that has innumerable cancerous cells. Okay, that does not lead to lump or thickening. So usually if your epithelial cells, okay, majority of the cancers in which epithelial cells are involved, lump and thickening can be felt. Okay. Weight changes, including unintended loss or gain. Gain can happen if the tumor is growing. That could add on to your weight as well. Weight loss will happen, as I mentioned earlier. These tumor cells, these cancerous cells are kind of a parasite. Okay, they deprive your own body out of nutrition. So an unintentional weight loss can take place. Skin changes such as yellowing, darkening, redness of the skin, sores that won't heal, or changes to the existing molds, whatever molds you already have. From years and years, it was the same size and shape, but suddenly the shape of the molds are changing, specifically the circumference of whatever mole you have. Okay, the circumference becomes to disintegrate. Okay, circumference of a mole, if it becomes it starts to disintegrate, usually that is a sign of cancer, skin cancer and all. Okay, so the skin changes can vary from what type of cancer you're suffering from. Okay, skin changes will vary. In some people, it could be yellowing, darkening, redness, sores, okay, etc. Changes in the bowel or bladder habits. Every morning you're supposed to empty your bowel, but after getting infected by cancer, the bowel pattern has changed. Okay, even at midnight or even while sleep, you may feel like you want to empty the bowel or bladder, and you may have to rush to the bathroom. Okay, so your bladder and bowel timing, which was usually appropriate to your lifestyle and schedule, that has become altered. Okay. Persistent cough or trouble in breathing. that can also take place. Nagging cough for more than 1 month. Okay. Dyspnea, that is trouble in breathing, not able to breathe properly. Difficulty in swallowing. Usually, if it is a tumor that is affecting the upper GI tract, okay, your esophagus, your any tumor or any malignancy that is found in the oral region because of smoking and all, it's very common. Oropharyngeal cancers. Then hoarseness of sound, that is a very husky, deep sound. Okay, very husky, deep sound, and it's which is not clear. The voice is not clear. That's the hoarseness in sound. Okay, persistent indigestion or discomfort after eating. Any form of indigestion. It could be acidity, bloating, okay, not able to digest properly, having a lot of issues with fatty food, protein-rich food, which are difficult to be digested, persistent unexplained muscle or joint pain wherever these tumors are affected, unexplained fevers or night sweats, that is sudden increase in your temperature, sudden increase in the body temperature. And when body temperature increases rapidly, usually people may also suffer from night sweats. You may wake up completely drenched in your own sweat. Okay, that is night sweats. Unexplained bleeding or bruising anywhere on your body. So those were the symptoms. Causes. Cancer causes can be caused by multiple uh, uh, cancerous agents. Okay, but one main cause that all the cancerous agents they do is they cause mutations at your DNA. Okay, mutation means a change, a small switch that has happened in the DNA. Now the all the DNA affected cells in whom the mutation has undertaken, those cells will differentiate and proliferate in a cancerous manner. Okay. All the other healthy cells in which this mutation was not done, okay, those will differentiate and proliferate in a healthy pattern. But only the cells in which the DNA had undergone this mutation caused by carcinogens, okay, it will act as cancerous cells. Okay. The DNA inside our cell is packed into large number of individual genes. Okay, DNA, it creates a lot of genes, and each of these genes contain a set of instructions telling a cell what function it has to perform and how to grow and how to divide. Okay, it is the DNA which is the sequence of the DNA in a specific form. It makes a gene. Okay, a bunch of genes come together in your cell, and they are the ones who direct the cells to perform in a certain way, to secrete certain enzyme, to produce certain chemicals. Okay, so all these functions that your cell is doing at the DNA level, okay, it is because of the instructions and guidance that comes from the genes. Okay, but imagine a situation where a mutation has taken place. Okay, this guidance will be reset all over again. These guidance, the guidelines from the genes will be reset all over again. Okay, now the cell does not know, or now the new guidance would be grow rapidly, divide rapidly, don't perform these functions, act in this way. Okay, now the system is completely hacked. Okay, so that's when you get a cancer. So errors in instructions because of mutation can cause a cell to stop its normal function and may also allow a cell to become cancerous in nature. Okay, so this is how the pathophysiology of cancer works at the DNA level. Is it clear to all? So the type of genes, now we will study about what are the different forms of genes that can cause cancer. The genetic changes that contribute to cancer tend to affect three main types of genes. Okay, procto-oncogene, tumor suppressor gene, and DNA repair gene. So these are the three different types of genes which are found in each and every one of your cell. Okay, each and every one of your cell has a nuclei. Okay, so it has a nucleus. Within the nucleus is your genetic material, is your DNA. Okay, genes are present in specific sequences. Okay, so proctogenes have a specific sequence. Tumor suppressor genes are having a different sequence. DNA repair genes in a different sequence. Okay, so but three of these genes are the ones who usually tend to get affected by mutation. So proctogenes, they are involved in normal cell growth and division. So if any mutation happens in proctogenes, normal cell growth and division will be affected. It would be abnormal. It would be accelerated. Okay. So when these genes are altered in certain ways or are more active than normal, they can become cancer causing genes. Okay. So any mutation that happens to proctogene sequence in your DNA, in your genetic material of any single cell, that leads to cancer causing genes, allowing the cells to grow and survive even when they should not. Then you have tumor suppressor genes are also involved in controlling cell growth and division. Cells in certain alterations in tumor suppressor genes may divide in an uncontrolled manner. Okay, so tumor suppressor genes, from the name itself, you know, at on a daily basis, many mutation is happening in your body. You don't understand that. Okay, the environment in which we live in, specifically if you are from a urban city, okay, a metropolitan city, or from an urban area. Okay, the list of carcinogens you are exposed to on a daily basis is far more higher than a person who is living in a rural area. Okay, so on a daily basis, your body is exposed to various many potential mutations, but all these mutations are not affecting you. So far, it has not affected you. The reason being, it's because of tumor suppressor genes. Okay, so these tumor suppressor genes are involved in controlling your cell growth wherever, even because of mutation, if a cell has become cancerous and it is starting to grow more and more, divide more and more. Okay, tumor suppressor genes are there to contradict that particular guideline. As I mentioned, genes are the ones who are giving instructions to the cells. Okay, when proctogene that has become abnormal is giving instruction to the cell to grow more, divide more, tumor suppressor genes will come with another set of instruction: don't grow more, stop your growth. Okay, so it is now the cell is having conflicting kind of instruction, and it usually chooses to follow the tumor suppressor genes or other variables in your lifestyle, maybe because antioxidants or your exercise or whatever lifestyle you are following. Okay, because of that, now the cell is not listening to the proctogenes instruction, it is following the tumor suppressor genes instruction. But what happens if the tumor suppressor gene is also undergoing mutation? Okay, that's when cancer definitely takes place and the genes will divide in an uncontrollable manner. And finally, you have DNA repair genes that are involved in fixing damaged DNA. Cells with mutation in these genes tend to develop additional mutations in other genes and changes their chromosomes. Okay, so the DNA repair genes are always on, like they are vigilantes. Okay, and if any duplications or deletions are taking place in the chromosome anywhere, it goes and repairs it using glucose, using amino acids. Okay, repair work is done. Together, all the mutations If it is happening even in the DNA repair genes, in Procto genes mutation took place. Tumor suppressor genes also have undergone a mutation. DNA repair gene will also undergo a mutation. Okay, so now three of these segments have undergone mutation. The cancer becomes a definitive result after this. Okay, so is it clear the different types of genes that cause cancer? Different types of genes, when they get afflicted, it leads to cancer. What do gene mutations do? Allow rapid growth, as mentioned earlier. Specifically, when procto-onco gene is afflicted, it leads to rapid growth of the cell. Okay, a gene mutation can tell a cell to grow and divide more rapidly. This creates many new cells that have the same mutation. And what happens in majority of the cases, new cells have come into existence, but sometimes they may be immature. They are not well developed. They are not functional enough, or they may be hyperfunctional, they may be high developed. Okay, so they may not have the same characteristic as its healthy cell from where it grew. Okay, fail to stop uncontrolled cell growth. If tumor suppressor gene is undergoing mutation, okay, there is no gene that is able to stop the uncontrolled cell growth. So normal cells know when to stop growing. So you just have the right number of each type of cells, each type of cancer cells. And when a cancer cell lose the control, okay, uh, which is supposed to tell them to stop growing, that is specifically your tumor suppressor genes. If it is getting affected, there is nobody to stop the cell to stop the cell from growing more and more. Okay, so cancer cells will develop here, and it will continue to grow and continue to accumulate in the same place. Make mistakes when repairing the DNA errors. As I mentioned earlier, the body is exposed to a lot of free radical damage, a lot of carcinogens, okay, from the environment, from the food that you eat. Okay, internal and external environment both play a critical role in exposing your body to the potential of developing cancer. Okay, and a lot of repair work is done by DNA repair genes. But sometimes when these DNA repair genes do mistake, they don't repair a mutation correctly. Okay, they don't nullify the mutation properly. It will continue to act as cancerous. It could continue to lead to cancer. Okay, so this is how mutations lead to cancer. What causes gene mutations? There are n number of reasons. Some gene mutations you are born with, okay? Maybe cancer, a specific kind of cancer runs in your family, like breast cancer, female, if any of your first female relatives have a history of breast cancer, like if a mother has a history of breast cancer, sister, aunt, okay, grandmother, so these are the gene mutations that you will carry in your generation as well. Okay. You may be born with a genetic mutation that you have inherited from your parents. And this accounts only for small percent of cancer, like cervical cancer in women, breast cancer, okay, colon cancer as well, that is also given genetically. Some gene mutations can occur after birth, usually because of carcinogens. Okay. So a number of forces can cause this gene mutations, such as smoking, radiation, viruses, okay, cancer-causing chemicals, we call it carcinogens, obesity, hormones, chronic inflammation, and lack of exercise. Okay, these are the internal and external factors that lead to gene mutations. So coming to the different types of cancer, first is carcinoma. They are the most common types of cancer. And when any of your epithelial cells, when they get involved, epithelial cells, they come in different shapes and size, okay? Squamous epithelial cells, columnar epithelial cells, transitional epithelial cells, basal epithelial cells, okay? So there are different types of epithelial cells throughout your body. Usually epithelial cells form the lining of your body, okay? Like you see the cheek inside your mouth, okay? The pink area of the cheek inside your mouth, okay? There also, that is also filled up of, that is also made of epithelial cells, okay? Your mucous membrane, okay? That are also different types of epithelial cells. The entire lining of your esophagus, your gastric lining, okay? Your gut lining, your tracheal lining, okay? They all are made up of epithelial cells. Different types of epithelial cells, shapes differ, okay? So if any mutations happen in the epithelial cells, and they grow rapidly and they function differently, it's called carcinoma. Okay. Carcinomas that begin in different epithelial cell types have specific names, like adenocarcinoma. Like adenocarcinoma happens in the epithelial cells that secrete fluid or mucus. Glands, okay? Usually the glandular, these are the glandular cells, okay? They are supposed to, some cells have the function to secrete a fluid, secrete mucus. You will find this in your intestine, in your upper respiratory tract, lower respiratory tract. Okay, so that is adenocarcinoma. The epithelial cells involved here that are supposed to produce fluid and mucus, if they get cancer, it's called adenocarcinoma. Basal cell carcinoma is the cancer that begins at the lower or the base layer of the epidermis. Okay, that is your skin's outer layer. Squamous cell carcinoma under the skin surface. Just below the epidermis is the dermis. Okay, so squamous cells you will find in the dermal region, dermal area. Just an example. Okay, so these are called carcinoma. When epithelial cells are involved, it's called carcinoma. Then we have sarcoma. Sarcomas are cancers that form in bone and soft tissues. Okay, it could include this tumor that is forming in your muscles, the adipose area, fat tissue, blood vessels, lymph vessels, fibrous tissues like your ligaments, tendons. Okay, osteosarcoma is the most common cancer of bone. Here, even in the example, the image here, you can see one osteosarcoma. Okay, one big bulge, a tumor here. This is sarcoma. When soft tissues are involved, okay, the cells in the soft tissues, they grow rapidly. That is sarcoma, bone cancer, etc. Then leukemia, cancers that begin in blood forming tissues of the bone marrow. Bone marrow is supposed to produce blood cells, okay? And if there is a cancer in your bone marrow, a cancerous region in your bone marrow, the bone marrow will not function adequately. That means in the formation of red blood cells and other blood cells as well. So as I mentioned earlier, these cancers, they do not form solid tumor, okay? Instead, a large number of abnormal white blood cells will be formed, okay? It will be built the blood and the bone marrow. Crowding out of this normal blood cells, okay? You can see in the image, how is the normal blood, okay? How is the leukemic blood? So whatever is the normal cells, they overpower and overcrowd the normal cells. So the blood will be densely packed with leukemia cells, immature. They are not functional. Okay, they are not mature. They are not functional. They don't help in your in the blood's function of giving you immunity, taking the oxygen from point A to point B. So functionally also the blood will not do much good for the host who has been afflicted by leukemia. So the body will not get enough oxygen. If there is a wound, it will not stop bleeding immediately. And if the white blood cells are involved, the body will lose its strength to fight infections. Okay. Then we have lymphoma. If you're aware of the lymphatic system, okay, lymphatic system, it has certain glands. Lymphatic system has its own vessels. It's not the blood vessels, it's the lymph vessels. Okay. It has lymph nodes. Like when you get mumps, if you have seen a person who has mumps, the lymph node is swollen, okay, under the chin. The lymph node that you have, that is completely swollen, okay. So that happens in mumps. So it's called the swollen glands. So that is a lymph, okay. So throughout your body, you have lymph nodes. Throughout your body, there are vessels that take the lymphatic fluid from the lymph nodes and transfer it throughout your body to fight infections, okay. So lymphocytes are T lymphocytes and B lymphocytes. The thymus gland that you have, that is also part of your lymphatic system. When you are a child, your thymus gland is active. But when you become adult, thymus gland is inactive. Okay. It shrinks in size because it is inactive. So lymphoma is a cancer that begins in the lymphocytes. So these lymphocytes, T cells and B cells, T lymphocytes, B lymphocytes, they are also disease fighting white blood cells, and they are part of your immune system. Just how your red blood cells are formed by the bone marrow, your white blood cells, the T lymphocytes and B lymphocytes, they are formed in the lymph nodes. Okay, and then they are also formed in your thymus gland. So that's why we have T lymphocytes. It is from the thymus gland. B lymphocytes, the cells that are formed from the bone marrow. Okay. So in lymphoma, lymphocytes are formed, but abnormal lymphocyte, immature lymphocyte buildup will take place in the lymph nodes, lymph vessels, and also in other parts of the body. And if there is a lymphoma, usually it is cancerous. That means it is malignant. Okay, because whenever a blood vessel or lymph vessels are involved, the cancer will spread. Okay, whenever a blood vessel or lymph vessels are involved, cancer usually spreads. So it becomes malignant. There are two main types of lymphoma: Hodgkin lymphoma and non-Hodgkin lymphoma. This you don't have to know in detail, just for information. So Hodgkin lymphoma, people with this, they have abnormal lymphocytes. Okay, and these are usually form of B lymphocytes. And non-Hodgkin, large group of cancer that start in lymphocytes, grow quickly, and it can be from B or T cells. Okay. Bro. Then multiple myeloma. So, do you know what is a myelin sheath? Those who are from the Yeah, neurotransmitters, they have a myelin sheath. Okay. That is the neurons. Okay, your brain cells, neurons, they have a myelin sheath, a thin sheet that covers the transmitter region, the axon region. Okay, here myeloma is not about the myelin sheath. Okay, it is about your plasma cells. Okay, plasma has different kind of cells, because usually some people may get confused. It is about the brain cancer or brain tumor or something like that. Okay, it's not that. Multiple myeloma, here we are talking about the plasma cells. Apart from red blood cells and white blood cells, there are plasma cells in the plasma fluid, in the blood plasma. Plasma cells are available. Okay. So don't get confused, okay? It's not about the myelin sheath here. Last time somebody had the uh, doubt here. So multiple myeloma is a cancer that begins in the plasma cells, another type of immune cell. Okay. Abnormal plasma cell called myeloma cells build up in the bone marrow and form tumors in the bone all throughout the body. Okay. And plasma, as I mentioned earlier, if blood vessels are involved, if fluid within the blood vessels, fluid within the lymph vessels, lymphatic fluid or blood is involved in any form of tumor or cancer, it usually spreads. Okay. Because these cancerous cells can go and deposit anywhere, and from there it can begin a new mutation. It can begin a new tumor or cancer. Then you have melanoma. Melanoma is a cancer. It's a skin cancer. Okay, melanoma. Melanin. Are you aware of what is melanin? Melanin. It gives color to your skin. Okay. Melanin is just a skin pigment. It gives color to your skin. Okay. So here the melanin cells are getting involved with cancer. Okay. So it's a cancer. It begins in the cell that becomes melanocytes, which are specialized in the cells that make melanin that gives pigment to your skin. Melanin, the amount of melanin cells you have in your body, that determines the color of your skin. Okay. People who are very fair, who are Caucasians and fair, they have very less melanin in their skin. Okay. People who have darker skin tone, they have more amount of melanin in their skin. Okay. And they can not just the skin, but even the color of your eye, the color of your hair. Okay, these all are because of melanin pigmentation. Okay, so not just on the skin, even the melanin tissues which are present in your eye, that can also get afflicted with this melanoma cancer. Okay, some examples of melanoma is given. It can be it usually people get confused with melanin and melanoma, and they confuse it with a wart or a mole. They think it's just a wart or a mole on my body, but it could be a melanoma. So all types of warts and moles that you have on your body, especially if you are a Caucasian, if you have a very fair skin tone, and if you have warts or moles on your body that looks similar to these kind, okay, you have to get them tested. Then you have the brain and the spinal cord tumors. So these are different types of brain and spinal cord tumors, usually based on the type of cells they are formed. Okay, you have different kind of cells in your nervous system, glial cells, okay, astrocytes. So the different types of cells are found in your brain and your spinal cord. So based on which cell is afflicted by the cancer, the name comes from that. Okay, for example, astrocytic tumor, it means star shaped brain cells have become tumorous or cancerous. That's about cancer.